In order to design a really effective student wellbeing model, we first needed to see what had been done elsewhere. Have the principles of social prescribing been used to enhance student wellbeing, and if so, in what way? This is where the Realist review comes in. We've been searching the literature in order to find out what worked, but we chose this approach so we could ask some additional questions. For whom did it work? In what context? To what extent? How and why? We formed what we call an advisory group, involving all the key stakeholders who meet regularly and discuss how the work is going. We went to the advisory group with some ideas for the terms we would use within our literature research, and they were able to help us by offering some further suggestions. A Realist review is cyclical, so we kept reporting back to the advisory group regarding how our searches were progressing, sharing the themes that were emerging. After searching the literature and screening out material that didn't help us to answer our questions, we were left with a small number of papers that we read in detail. We needed to know if a social prescribing intervention was present, how it changed the context in which people were living, and the way this triggered different behaviours. We call these mechanisms that resulted in particular outcomes. Going through the papers looking for these allows us to generate a theoretical model. We call this a programme theory of how social prescribing can work for HE students. All of this activity feeds into the work we're doing on building our student wellbeing model.